Oh, I can.
Yeah.
All right. So let me hold on for a second. I'm not going to share yet. Good morning, everyone. Thank you for having me again, as usually.
Since our PA's not working, I hear him, you probably need to come over here.
I tried to drive, but the clinic just finished, so I'm going to do this, which was not my preference. Do it virtually. Um, so I know Linda had asked me to talk about the grant that we have with the American Heart Association, and Linda, I promise I'll do that one day. Uh, today I was going to do something different, and it's not that there's any problem with talking about the AHA grant, but this just came to my hands. What I'm going to do, the presentation I'm going to share with you today, just came to me this week, and it's something that we're planning to use as an educational session for patients with heart failure in our cardiac rehab program. So it's an educational program for patients with heart failure, and it's a slideshow for one of us in cardiac rehab to educate patients about what heart failure is. So the presentation, although I'm just giving you the context of where it comes from, the goal is for you to learn more about heart failure. What is heart failure? What are the two kinds of heart failure? And learn a little bit more about it. And then there's some into the presentation about what can you do to stay healthy with heart failure. I would preface with saying that everything that we say here to be healthy with heart failure, it's equally valuable to stay healthy with high blood pressure, and it's equally valuable to stay healthy with diabetes and other cardiovascular diseases. So there's nothing magical about the presentation that's only for heart failure. It just happens to be the kinds of things we try to educate patients with heart failure about. But you can apply everything I'll say about education, about how to stay healthy to high blood pressure. So with that preview, let me start. Oh, and so at the end, it'd be nice if you guys could give feedback to Linda and or to me about this presentation, especially in terms of how did you like the slides? How did you like the content? Whether it was accessible to you, whether you thought it was clear, and because we'll be reviewing this, and if we need to update it or change it to make it more effective, then we would like to have feedback from people like you. So, and people like you means people in the community. So, all right. So this is the first lecture, educational lecture from this new program that we just built called Heart Strong, Living Healthy with Heart Failure. And in fact, Sharon Myers has been helping us for the past year and a half or 2 years to actually get to this product. So this is a collaboration that we did with health management and education and the heart failure clinic. So let's get started. So usually when we're in a group with patients, we ask to turn off their phones. Then we ask people to introduce themselves. And so with these introductions, we ask people to share their name and complete the sentence. My personal reason for learning more about how to live healthier with heart failure is, because we always want to know kind of what's in people's minds when they come to a heart failure class. The objectives of the session are going to focus on, after attending the class, we want you to state what heart failure is and why self-management is important. We want you to be able to describe the common symptoms and causes of heart failure. We want you to identify warning signs and symptoms of that heart failure is getting worse and what action to take. We want you to understand why it is important to keep a weight log and know how to use it or how to do it. And ultimately prepare for your doctor's appointment, which is where you would then receive feedback about these logs. And last, there's the concept of creating a SMART plan. I probably will run out of time before I can talk about the SMART plan. So I'll probably stop right as I start on that and hear your feedback at that point. So the Heart Strong concept is in this slide. So we think that you need these, to stay strong, you're going to need all these elements. So the S stands for self-management and knowledge. The T stands for taking your medicines as prescribed. The R stands for rethinking how you consume sodium and fluid. The O stands for optimizing your physical activity. And then the N starts for your needs and emotions. How are we doing with our mental health and our emotional health as well? And then at the end, we wrap it all together about how do you put all this together so you can keep going strong despite having heart failure? Because well, at the end of the day, we want to try to maximize how well you can perform and be functional in your life, even if you have the diagnosis of heart failure. So this module that I'm talking today is the self-management and knowledge. So the first part is to understand heart failure. So we think that what you're going to learn in this class can become the tools that you use to actually do what's called self-care. And in self-care, the goals of self-care is to make sure that you can feel better, live longer, healthier lives, that you can stay out of the hospital, that we can slow down the progression of the heart failure, and that at the end of the day, you can actually feel more confident that you can better manage the heart failure. So we figured that before we can better manage something, we might as well know a little bit about it before we can actually manage it. Here I mean the heart failure. So heart failure is a condition in which the heart has a difficulty pumping enough blood out to the rest of the body. So in a way, heart failure is a disease of the rest of the body. So your brain doesn't get enough blood, the stomach doesn't get enough blood, so you feel dizzy and you lose your appetite and you don't feel good. So that's how the heart failure affects your entire body. Not enough blood gets to for the body's needs. So if you don't have enough blood flow, you don't have enough oxygen and nutrients, which is what the blood takes to every organ in your body. So what are the causes of heart failure? Well, here's some of the most common causes of heart failure. An academic list has like 50 to 100 things in it, but these are kind of the high group categories. Heart attack and coronary artery disease, still the number one cause. And this is the cholesterol plaque building on your arteries, going on to having chest pain, heart attacks, and angina. High blood pressure, which we talked a lot about alone, 45% of Americans have high blood pressure. So it's a very, very common thing. Heart valve disease or damage from inflammation of the heart muscle, abnormal heart rhythms or arrhythmias, or it could be hereditary. And this is probably a smaller number of the hereditary. Most of the causes are the top causes, which a lot of them are acquired, meaning they're things that happen to you because we're living the life we live. Some of them are structural, just the way your heart was built from factory, and some of it may be hereditary. And sometimes it's all three of them or all four of these combined. So this is part of what your doctor does in the office, trying to figure that the first few times, trying to figure out why is it, what are the causes? Because depending on the cause, we can choose specific treatments. So now that we know what it is and what causes it, we've got to think about heart failure is not a static thing. It's not something you get and then it goes away. It's not like a cut on your finger that just heals and it goes away. It's somewhat of a process, a progression of a condition over usually months to years before you actually get the heart failure. And then once you get first heart failure, your body reacts to it. And so it kind of does things to your body that perpetuate the heart failure and it ultimately gives you symptoms. So this is kind of the cascade of things that happen. First, you have a condition that causes the heart failure, like a heart attack or atrial fibrillation, which is an arrhythmia, or the high blood pressure. So then your body starts making certain substances and the heart starts releasing chemicals in the bloodstream and ultimately activates the stress hormones and the inflammatory components of your body. So now you have an inciting event and then chemicals that are circulating. And these chemicals go on to change the way the heart works and structure. So it changes its size, it changes its shape, and ultimately leads to the difficulty with the function. And now the heart is not able to pump enough blood. And so it's at that point where you have the inability to pump enough blood that then you start getting short of breath, or you start developing swelling or tiredness or poor memory or weight gain, which are the things that the type of symptoms we usually see. So most patients begin this journey of understanding what happens to them at the symptom stage. So part of being educating people is to try to help you understand the first 3 steps that leads to the symptoms, because it is here on these 3 steps that we can hopefully make some changes and help you stay healthy. So how would that look like? Well, if you have high blood pressure, we treat the underlying cause. That's what we do, number 1, and then we block the progression of it. Or if you have a heart attack, we treat your heart attack, and that will block the progression of this. So let's say we don't have a good treatment, or you missed the treatment, or whatever the situation is, then you then now start having the condition. Now what we want to do is stop the release of the substances that cause the remodeling. So these are the chemicals in the bloodstream that are released from the heart. And so we have medications for that. So this is why you take a lot of the medicines to block these release. And then if we are successful with that, then we can slow down or reverse the remodeling or the changes that happen in the heart, such that we don't develop the symptoms, or if you have the symptoms, we decrease the magnitude of the symptoms so you can feel better and still live strong. So these are kind of fun pictures to show, but they can be overwhelming to people. But this is trying to distinguish, looking at a heart picture, the differences between the two types of heart failure. One is the heart failure with reduced ejection fraction. The other one is called heart failure with preserved ejection fraction. And I know I haven't explained these words to you, so I'm going to explain them in a minute. But this is what we used to call systolic. This is the old name. This is the new name on the top, and this is the old name. And usually what happens here, the heart gets kind of bigger. This is the main chamber in here, that the left ventricle that that pumps the blood. It gets thin out, it gets dilated, it gets dysfunctional, and so blood cannot come out. So it's kind of an ability to squeeze out. The diastolic, or the heart failure with preserved ejection fraction, there's no problem pumping it out. You can still pump it out. But what you have is a problem that when the blood comes in, shown here with the blue arrow, when it comes into the heart is too stiff. So not enough blood can make it into the heart because it's too stiff. It doesn't fill up. Like try to fill a balloon that's very stiff. It's really hard to put that air in there. So the same concept here, the heart is too stiff, then you are unable to put enough blood. So then when you try to squeeze out, you just can't put enough blood out because not enough came in, essentially. So what is the ejection fraction? Well, it's a number, and it's a commonly used number in the clinic, and you will hear from your doctors, and your medicines are determined whether you're eligible for the medicine based on this number, and you're determined whether you're eligible for rehab based on this number. This is a very powerful number because it tells you, and it tells us a lot about what the next steps are. So this is the ejection fraction is just the portion of the heart, the portion of the blood in the heart that gets pumped out with every heartbeat. So think of it this way: when every time your heart fills up, it fills up to 100%. That's full, and every time you pump, you eject out or you pump out about 70%, 60 to 70% of that. That's the normal amount that needs to come out of your heart. So when you cannot put out that much in the heart, then you have heart failure. So the heart failure with reduced ejection fraction being the pumping mechanism, the pumping ability, is defined by 40% or less. Remember, normal is 60%. The heart muscle has trouble relaxing, and so the heart ultimately has an inability to pump the blood. Yes. Are you calling me?
No.
Okay.
Essentially.
Okay, good. Thank you. Sorry, I figured Linda was calling me. It's probably something I should know, but that was a fluke. Anyway, moving forward. So the heart failure with preserved ejection fraction, again, the ejection fraction is normal, so it's 50 or greater, but now the heart is stiff, and the stiffness is what makes the heart not be able to take the blood in. So let's think about a patient. So this is Mike's story. So Mike has heart failure with reduced ejection fraction. The walls of his heart are enlarged and thinner than normal. his heart cannot squeeze out enough blood to meet his body needs. So Mike doesn't always take his prescribed medicines either. And sometimes he forgets or feels like he needs a break from taking medications. That's Mike's situation. So let's talk about what are the tools in the box to slow down Mike's heart failure and maybe make him feel better. Well, we can start by trying to treat the high blood pressure. And then if we can treat the blood pressure, then his heart failure wouldn't progress very much. And then we can also give him block the chemicals or the substances that come from the heart failure with the medications. And then hopefully with that, again, we slow down the remodeling and then we minimize the symptoms that he has. So it'll be very important for him to understand that the blood pressure numbers need to be controlled and that our medicines he needs to take to control these chemicals so they don't progress further. This is a moment to take a break. I just gave you a lot of information. If there's any questions in the room, anybody wants to, before I move to the next part, do you want to ask any questions about what I just said before we go forward?
Javier, what is the substance that narrows the arteries or whatever that last point was, that the ACE inhibitor
Yeah.
would block a substance that narrows blood vessels?
Yeah, so angiotensin 2 is the chemical. So A stands for angiotensin converting enzyme. So it's the enzyme that makes that chemical. We use the beta blockers. We block the norepinephrine is the substance, or epinephrine. Norepinephrine is the naturally occurring substance. So the beta blocker is blocking the norepinephrine. So all of these are substances that are made by the nervous system, the kidney, and or the heart in response to heart attacks or high blood pressures and things like that. And those chemicals, when they circulate, they perpetuate the problems with heart failure.
Thank you.
You're welcome. Anyone else? If not, we'll keep rolling. All right. So to manage the heart failure, as I just talked about, we try to treat the condition and we try to block those chemicals that are going through. But there are some things about lifestyle that we can also do to help. So this is an additional tool in the toolbox. And this will be fluid retention, managing your fluid retention and daily weights. So to do that, we have to monitor. And so that's why we need balances to monitor the weight. So let's talk about the fluid for a moment. How does this affect the situation in the heart failure? Well, too much fluid in the body can cause uncomfortable symptoms like swelling, shortness of breath, or weight gain. It also overworks the heart and makes the heart failure worse. Why? Because when you overwork the heart, then it makes more chemicals. And those chemicals go back and remodel some more. And it just, you're trapped into this loop of failure, hence the word heart failure. And so unless you break it somehow, then it just leads to worsening of the heart failure. And ultimately, the fluid could do this hard enough or serious enough that it can actually be life-threatening. So how do you weigh yourself to be able to keep track of your weight? So there's some specific rules, because the better you follow the rules, the more reliable the numbers are. And then we can make better assessments from week to week, from month to month, from year to year about how you're doing. So we always like you to do it on the same time every day. It's best if you do it in the morning right after you wake up. You want to urinate first, and you want to do this before you eat. Try to wear the same amount of clothing. So, remove some layers. If you, in the winter, you're using a lot of layers to sleep in warm. And just try to keep it to the same amount of clothing. You want to use always the same scale, and you want to have it in the same location, and just kind of be very routine. Have it in a single place in the house or in the home or in the apartment, and always do it in the same way. And that way we get the most reliable numbers. Then you want to keep track of them. So the weight that we're interested in is called the dry weight. So this is the weight that we want to identify for you. It's your weight at which we think you don't have much fluid, much extra fluid. So your body's in what we call a more compensated status, or in a more kind of baseline or normal status. And that becomes your target weight. The dry weight becomes the target weight. So we check the dry weight on a daily basis and ask you to keep a record. And so we give you some instructions. If you overnight, so from yesterday morning to this morning, you gain 2 to 3 pounds, or if over a week, so when you look at your numbers throughout the week, you have a total of a 5-pound gain, and that's when you need to call the healthcare providers for help, because it may be nothing, but it may be the first sign that you are retaining excessive amounts of fluid. And if we don't do something early, then again, it sets up that wheel of where you get trapped, and the fluid generates more chemicals, and there's more remodeling, and then you don't feel well. And then when you come to your appointments, bring your weight loss. So maybe you're doing really well for 2 or 3 months. So when you come to the appointment, bring the log, because then we can see that you're doing well, and then we can correlate the how your weight has changed with the medications as they change. And that's very helpful and very empowering for us to be able to help. Now, what if there is some symptoms from the fluid retention? What symptoms should you look after, and what should you mention or talk to your doctor about? Well, you should know what these are and write them down. I'm going to go over what they are in a second. You want to write them down so you can communicate them with the doctor. And then there are some educational sheets or information that you can have at hand to help you. If you don't want to write it, you can just get one of these sheets and you just circle what you're feeling and put the date or something next to it, so you know what was feeling at that time, your symptoms. So I'm going to go over those with you using those sheets, which are available from the American Heart Association. So this is the group of all the symptoms that for heart failure that you should be looking out for. So let me go over them one by one. So there's the weight gain. So if you're gaining weight and you cannot explain that from eating more food, then that's a concern for potentially heart failure. By the way, none of these by themselves mean that you have heart failure. And as you're going to see, they're very common with many other conditions. So a lot of times we need a group of these and to be able to make the diagnosis. So it's not a single thing. You may be having some cough. You may get short of breath when you bend down to tie your shoes. You may notice that your shoes are tight because your legs are swollen. Maybe your pants are getting tight because your belly is getting swollen. Maybe you're feeling palpitations, like the heart gets really fast, maybe when you do very minimal activity, or even without doing any activity. Suddenly your heart speeds up, or you're getting short of breath when you are going out the door and do your shopping and walking the dog or something. You notice, wow, a couple of weeks ago I could do that just fine, and now I'm more short of breath. What's going on? You get more fatigue, so you're more tired after doing the same amount or even less amount of things. You're feeling bad at night in such a way that you even have to prop up your pillows or prop up the bed to make you feel better and be able to actually sleep. You may even have chest pains, which don't always mean you have a heart attack. People with heart failure can have chest pain that is not a heart attack. Waking up with shortness of breath in the middle of the night. So this means that you lay down, you fell asleep, and like 2, 3, 4 hours down the road, you actually wake up and you just, oh my God, I can't breathe, and you have to sit up or get out of the bed to feel better. Or if you're a person that uses oxygen routinely, you are having to use more oxygen than you were prescribed. So these are symptoms to observe, keep track of, and reach out at some point to your provider. Now, how do you know that you're doing really well? So like if you were to have your blood pressure treated, your medicines are all adjusted, and everything is going well, you wouldn't have chest pain. The weight gain doesn't come back. You find yourself having normal physical activity. If you had swelling, the swelling tends to get better. And your breathing, whether it's at rest or when you're exerting yourself, tend to improve. So when you feel this way, we say, great job. You're successfully managing this heart failure. You're living strong because you can stay, you don't have symptoms, and you can keep going with your things. So when you feel good, you still have to do some things. You want to keep checking your weight. So if at some point, for whatever reason, the weight changes, we can tell. You do have to take your medicines. A lot of patients believe that once they feel well like this, they can stop the medicine. And with heart failure, that is not true. Sometimes we stop the medicine, but it has to be a careful decision with the doctor, not something we do at home just because we feel well. We clearly have to reduce the sodium intake, which promotes fluid retention. And then you have to keep coming to the follow-up visits where you bring us your numbers, your daily weight checks, your blood pressure levels, and the medication, so we can kind of put it all together for you. Now, there's some times where you have to be concerned. So if you're starting to have more of a dry hacking cough, suddenly you start having more weight gain, again, more shortness of breath, leg swelling. If these things are happening, then and you were doing well for a while, and now these things are coming back, then we need to contact your doctor or healthcare team. And then think again, what did I do yesterday, the day before, the last 3 or 4 days? Did I in some way didn't follow my goals with the sodium? Because this kind of happens from a day to day. This could happen where you don't feel well the next day after yesterday. You may have had a meal that may have had a lot of sodium, and you retain all the water throughout the night that you drank, and now you're swollen and you don't feel as well. So review again what you did in the last few days, specifically about the way you ate that may be contributing to this. And here's some symptoms again that are warning signs to actually call for help. And this will be, on the day that you feel this way, or that you have to call the physician, or if not, if you feel severe enough of these, then call 911. So again, further worsening of the cough, additional 2 to 3 pounds in 24 hours. That usually, if you feel well in every other way, if you just have the weight gain, usually that's a phone call. If you have the weight gain and the shortness of breath, you need to go to the clinic right away. Maybe you feel dizzy or confused. That's a sign that you need to go to the emergency room. You get lost appetite. When the heart failure progresses enough, the food doesn't settle very well because the blood is not pumping, the oxygen is not getting to your stomach, and you just don't digest the food well. And then you have trouble sleeping. So the progression of these from mild to more severe, if you haven't yet reached out to the clinic or to the doctor and it's getting more severe, then you need to go to the emergency room at that time. Now, we want to avoid the emergency room visits, and we want to actually keep you coming to the clinic in a routine basis with your numbers, and we want to prepare for that. So when you come to the doctor's office, you get the most benefit from that visit. A lot of times we don't have all the information, and we say, oh, you have to call us, you have to come back next week, you have to do this again and again. So if you come prepared, we can actually address as many things in one sitting, and that is usually more efficient for everyone and allows you to ask questions from the doctor at that time. So keep and bring a list of all your symptoms that you've collected, and we just talked about those. If you have a booklet or instructions on how to manage or treat your heart failure, bring that with you. Maybe you have a medicine list. Maybe you have specific instructions on when to check the blood pressure. So anything that you have in writing that you should be doing to keep you healthy, then you bring it. Always carry a list of your current medicines and supplements, and put it on your purse, put it on your wallet, put it on your backpack. It's always helpful to have that list at hand because most people can't remember everything about every medicine they take. And it is at a time when we need to manage or change things, it's very important to have every medicine and every dosage of it at hand to decide that. And lastly, if you have the opportunity, bring someone with you, because no one really remembers everything. And on top of that, if you're not feeling well, it's a lot harder to actually remember and be able to act on the instructions that are given. There's a question on the chat about the slides. These slides don't belong to me. They belong to the university through the health management program. So I would say they don't want me to give them away. So I won't be able to give these away. These are not my slides. This took a year and a half of a lot of people to put this together. All right, so we're going to talk a little bit about values and goals, and then I'm just going to stop because I like to hear your feedback. And I'm not going to go into the smart planning component of this. So this is to enter the conversation that, to stay healthy, to be strong and keep your symptoms away, we have to maintain a healthy lifestyle that will get us to that point. And we talked a lot about that already. So how do we as people focus on doing something and ultimately taking action towards a healthy lifestyle? Well, this is one approach. One is we first evaluate what are our values. What's important to us? What does it mean to be healthy or as healthy as I can be? This is personal. It's what you think, what you feel, what you like. Write it down. It's really amazing what happens to us when we put our thoughts out on a piece of paper. Somehow there's clarity and comfort, lots of many emotions that can come out of putting something on a piece of paper. So answer this question for yourself. Then ask the next question. What do I need to accomplish or to do to stay as healthy as I can be? First, you define what's valuable to you to be healthy, and then you ask of yourself, what do I need to accomplish? What do I need to accomplish to do that? And there is the tools. What tools can you use to do that? And we talk about some of those tools, and through this class, we talk about other tools that people can use for that. And then once you evaluate your values and your goals, then you can sit down and put together a smart plan. And in here's where you then write down the steps of what it's going to take to actually achieve that goal that you have. The goal that you have and you value. So it's a personal journey, and in the smart plan, it gives you a stepwise process to get that clarity that you need to actually act. So in the class, we would then start at this moment to start going around the room and starting asking people to do the exercise. So there's a form in which you start answering the questions, and then we move forward from that. And I'm going to stop there because the goal of this presentation was not to have the group exercise the smart plan, but rather introduce the slides and the didactics and get some feedback from you. See what you think. See whether we are right on or we need to keep working on this. So. Any questions?
I think it was very, very helpful, very clear. And there was no screen that was so busy that you couldn't take notes or whatever. I think the thing that always appeals to me is your mention of sheets from the Heart Association that would help people to just check a box or circle. I'm a note taker, so I just write things out all the time and keep notebooks around. But I think for many, if not most, if they had something handy, so maybe they could incorporate in this presentation a website or a picture, a sample of a sheet like that to motivate people to get it, and how they could get it easily. And then they could have those to just check or circle. Oh,
yeah,
great.
That's a great comment. Yes, they get a book with this class. And in the book,
Oh.
we have all the handouts that we mentioned that could be used as tools. Those handouts will be in their book.
Great.
So in the classes, you get the actual book with the additional details.
Great.
So thank you.
Mhm.
Any other comments?
I was noticing that nutrition doesn't get a lot of coverage here. You talk about sodium as a disembodied chemical, and really having nutrition and really a lifestyle change, that seems to be diminished by these sort of externals that are things that someone could easily bail out on. That teaching somebody that it's more than getting on a scale, it is following through with your daily exercise, it's following through with de-stressing, it's following through with a regular, well-balanced diet.
Yeah, great for thank you for the question. So I'm putting the slide up again. So the program has actually, I didn't explain any of this. The program has 6 classes. This will be class number 1. So we're just introducing the fact that they're tools. So mostly we're just listing them, you know, physical activity, nutrition, sodium. Sodium tends to be the focus for a patient with heart failure. And so that's what the only one we touch upon here. But then they're going to go to class number 2, where they're going to talk about their medications. They're going to learn about the medicines and how they work. Then the class rethinking sodium and fluid, that's a nutrition class. It's all about the nutrition. And it's about what's the healthy diet, what's the diet without the sodium is the more natural diet, is the not processed foods. So it's actually a complete module on nutrition. And then they optimize the physical activity, it's a complete module on physical activity. And then the last one is our conception of talking about stress, is what are our needs and our emotions. And so we grab the top 3 lifestyles, the nutrition, the physical, and the mental health or emotional stress as the 3 main areas that will be taught in the class. People get taught about the medicine because the medicines are integral to the care of the heart failure patient. And at the end is how to put it all together and how to use all these tools together and how to organize a plan to make changes in the future. So it's a 6-hour class. This was meant to be only the first one of the 6. And yes,
Dr. Lopez,
nutrition will be covered 1/5 of the time in the program.
Dr. Lopez, I have a question. Early on in your talk, you mentioned the fact that blood pressure and diabetes were closely related or related to this heart failure. From the images, I could see how blood pressure would impact heart failure. However, as a person with newly diagnosed diabetes, could you say something about that?
Sure, thank you. Yes, so diabetes, there are a couple of ways to answer that question. One of them is say that, well, things that contribute to diabetes may also contribute to heart failure. So if you treat the contributing factors, like for example, if you have a sedentary life, being sedentary tends to promote diabetes as much as it can also promote or accelerate your heart failure. So it's from the risk factors, and the lifestyles are similar. So that is one aspect of it. The other way to answer this question is, once you have diabetes, what is the abnormality in your body with diabetes that may affect negatively your heart? And so this is now inside of the body, not what happens outside with your lifestyle, but inside of the body. So when you have diabetes, and there are 2 kinds of diabetes, the type 1 diabetes, which is the kind of the early onset diabetes, early being in the younger time of life. It's the one where your body, your pancreas in your body doesn't make much insulin. So there's no production. And so you have high sugars in your bloodstream from what you eat because you have no insulin to put it away. Insulin is the chemical or the hormone in your body that put things away, put the glucose away where it needs to go. Now, type 2 diabetes is it's messy and complex, let me just say, but in general, so it's a very high level generalization. It's associated highly with what we eat and our physical activity. So if we have a lifestyle where we eat high caloric, high sugary, low fiber, low plant-based diet, very processed meals, then that will favor to have high levels of glucose. And the insulin that you have, it just doesn't work as well because it's overwhelmed. So that's what we call insulin resistance. Is your insulin is overwhelmed. You have it, but you just can't do the work well. And so you tend to accumulate fat. You tend to have higher levels of glucose on the bloodstream. You get high blood pressure. And now what you have high cholesterol. All of these happen as part of this insulin issue. And that's what we call the metabolic syndrome. So all of these are essentially the same concept, just different names to it. But it's driven by the insulin that you have that it's not sensitive. So you're going to ask me, how do I sensitize my body to the insulin I have? And that is by changing what we eat. We eat more plant-based with fiber in it, no processed food, which is exactly what we say to the heart failure patient. What do we do to the diabetes? We ask that you exercise more, because when you exercise more, your muscles will get stronger and burn more glucose. So you can eat the same amount of food and have lower levels of glucose. Exercise also tell the insulin with the exercise, somehow they just have a good language between the two. And the muscle and the insulin, they know how to put away the glucose when you have exercise. If you don't have exercise, your muscles are weak. Then your body, the muscles don't contribute to your glucose control. It's just your liver at that point. And then the liver is overwhelmed with insulin resistance. So it's like bringing a helper. Exercise is like bringing a helper to the liver to put away the glucose. So I think those are the two ways I would say they're interrelated. Diabetes itself, when it's uncontrolled for a prolonged period of time, can actually cause heart failure. But that's a bit more complex biochemical interaction. And that takes years a lot of times, and it's usually uncontrolled. So if you have diabetes as a diagnosis, but your numbers are real good, you take the right medicine, and you're exercising, eating healthy, you can live forever from the diabetes point of view. We've learned that if it's well controlled, if we can control it well, we can control the numbers and do the things we just did, people can live healthy for a long time.
That's optimistic. Thank you.
That's my job, to be optimistic.
Dr. Lopez?
Dr. Lopez, we have a question here.
Oh, yes, please.
I do have the family history of heart failure, and I had Graves' disease, which I do not, they got my thyroid out, but I never got diabetes. But because of this program, I do follow all the diet and everything. So I think I'm keeping myself healthy and everything, watching my blood pressure and everything. But I was wondering, does thyroid have something to do with it?
I'm sorry, what was the last part? The what?
The thyroid, does that?
The thyroid. Oh, yes, absolutely. So the thyroid is very important to keep your heart healthy. When your thyroid, so thyroid is a gland in the neck, and it produces thyroid hormone. And this hormone is very important to regulate a number of things. In fact, many things, but some of it is the temperature of your body, and some of it is the metabolism of your body. It affects the blood pressure. So when you have low thyroid, you get higher blood pressures. So it creates hypertension. So when I'm taking care of patients with hypertension, I check their thyroid function, because the blood pressure gets easier to treat if I treat the thyroid. So absolutely, the thyroid hormone itself, when it's a chemical that goes in the bloodstream, when it goes to the heart, it actually, it's like a fuel. It's like I wouldn't say it's fuel. Fuel is the glucose or the sugar. It's more like a spark. It's like a little bit of a whip into the heart, if you will. So it just kind of gives it a little hump to keep going. If you don't have the thyroid hormone, so you're low in your thyroid hormone, then the heart doesn't have that. It's just kind of sluggish and like, because it has no motivator to keep going. So the thyroid hormone is kind of like a motivator to the heart to keep going. And so that's why we like to normalize. When somebody has, like in the case you described with Graves, they ablated your thyroid. So you then probably, if I had to guess, you probably take some supplement.
Yes,
Because in that ablation, you lost your own ability to make thyroid hormone, and then you're supplemented, and then they check your blood levels. And based on those blood levels, we can adjust the medicine to make sure that you have enough thyroid hormone. And if you have enough thyroid hormone, then the body regulates well and you do well.
because I check it, you know, and then it keeps it up, and I do take my thyroid, the medication and all that. Thank
Yeah,
you.
every 1 or 2 years, we get one patient admitted to the hospital, which has this horrible picture of heart failure and is very sick. And we figured out that the thyroid is a single cause. And it's the best case to have because you know that you can treat, usually, and this could happen in Graves' disease when you have the hyperthyroid portion of it. So if you have a lot of the hormone floating around, your heart gets really it gets put in overdrive and it wears out. And then you go into heart failure. And so we can treat the Graves' disease and get the hormone down to normal, put them on the regular medicines that we do to control the other chemicals. The heart recovers very nicely. And as long as you keep that thyroid at a normal level, most of the time it doesn't come back. So it's really rewarding for us to know that if we get this one right, we probably keep this patient out of the hospital for a long time because heart failure may go to be just normal heart function.
Thank you.
Excellent. Any other comments or questions? Well, thank you so much. I appreciate your time. And Linda, is there anything else you want me to address or?
Linda's not here right now. Thank you so much, Dr. Lopez.
Okay. You're
Thank
welcome. Thanks,
you.
everyone. Have a good
Thank
weekend.
you.
See you the next time.
Yeah, see ya.
Bye-bye.